It's interesting to me that in Georgia, our foster care outcomes are really some of the best in the country. So again, distinguishing between the Child Protective Services side of the work and the foster care side of the work. So for children who are brought into our state's protective custody, for the outcomes that we seek for those children, which are measured and comparable across states, we actually do quite well. And I'm proud to say that, and it boggles my mind that that's not a narrative that we share, that's not a narrative that we're often willing to receive, but that's in fact true. We have one of the lowest foster care populations in the country, and that's all fine and well, provided that we can make assurances of safety. Well, in fact, our assurances of safety are very high. We have one of the lowest rates of the recurrence of maltreatment for children who our system has intervened with. So by that I mean a child who's been the subject of a confirmed or substantiated report of child abuse or neglect. We have very few of those children who are the subject of a second report within 6 months. And in fact, today, as we sit here today, children, by that outcome measure, children in Georgia's child welfare system are twice as safe as children in Florida's foster care system, which is what we've modeled this after. So I think that's something that we should really take under consideration. And so we certainly have room for improvement in our foster care system. I wouldn't be, I don't think anybody would suggest that we have it perfectly. Senator Miller's, the working group that he led, canvassed a number of those issues. And from a data perspective, really what we're looking at are deficiencies in placement stability, meaning that children who come into our system move around too much, and that's disruptive to them, and that further traumatizes them, and interferes with their ability to be healed and returned and reunified home. That's something that we can look at, and there are strategies for that we should consider. Likewise, even from Florida or Tennessee, which also has privatized a certain extent, we can look at strategies to increase the timeliness of our adoptions. Those states outperform us with respect to timeliness of adoptions. Interestingly enough, Senator Underman, with your interest in timely reunifications, Georgia actually outperforms those other states in timely reunifications. It's another area that we do quite well in Georgia, that when children have to be removed for their own safety, we're able to get them back with their biological families quickly and again permanently. They don't re-enter our system after we do that, meaning we've had an effective intervention at that point.
There are some things that I think that we need to look at in this work, in the privatization work, that I believe that nonprofits, and especially faith-based nonprofits, can do extremely well. Number one is foster care parent recruiting, okay? I actually have some friends in Florida who are involved in recruiting church and synagogue families to do foster care. That needs to be a priority. We need to find ways that if we do have faith-based and community-based groups doing this work, that they have the opportunity and the ability to make sure they're getting services for their children. Let me give you kind of my concern here. So, right now, for example, we are in the process of privatizing, or at least putting under a care management organization, the foster care population, as y'all are well aware. The mayor group will be taking over that fairly quickly. So all the behavioral health, et cetera, for these foster care children, and of course these children have many behavioral health needs, will be provided for by a care management organization that contracts with the Department of Community Health, of course with DHS. What I want to make sure that we have is if we have a privatized, for example, foster care provider, and a privatized behavioral care provider, and other privatized providers, that we are building into the system some way that we don't have to go up and down a long chain of bureaucratic hierarchy to get things done. We need to give folks mandates that they will serve these children, that they will do certain things for these children, that they will not, for example, dump children here or there. It is a very, very complex system, so I want to make sure that when this is set up, and as you go through the process of setting it up, we don't forget how interwoven all of these organizations have to be, all of these services have to be.
What I would tell you is I've been 38 years in the state of Georgia in child welfare, 35 of them in the private sector, 23 of those running Inner Harbor, which was one of the largest residential treatment center in the state of Georgia for many years. I also worked the last 3 years before I came into this role at DFCS, 2 of which I was state director of DFCS. I can tell you it opened my eyes in a way that I never had my eyes opened before. And I think it's kind of like that old saying, if you haven't walked a mile on a person's moccasin, you better be careful about what you say. I received a children death every day on my BlackBerry during the time I was state director. put the first names of every child that died during the time as state director on my church's prayer list to pray. So I remember very clearly and vividly every one of those children that died. During that time, we started the child death reporting, and not only reporting, but the case studies that we did, as well as publishing those and some other things. And I'd be glad to talk to anybody that want to talk about child fatalities in the state of Georgia and what needs to be done and what hasn't been done yet. I also can tell you, with Senator Unterman's conversation about $30,000 for a master's level employee, the fact of the matter is we have employees that got their master's degree 7 years ago, making $30,000, and there hasn't been a state raise for those people. So you have some folks out in the state that have a master's degree, 7 years experience, still making $30,000. So there are many, many issues to come to bear here. But that's not why we're here today. We're here about Senate Bill 350. I think it's a fantastic opportunity that we're all here today and that we're having these conversations. Like I say, 38 years, been here in the state of Georgia, and many, many years have gone by without any conversations about how we can improve child welfare in the state of Georgia. So I think it opens the door for a lot of conversations. I've listed here about 15 bullet points that initially our membership, some of our membership, would like to be considered as the bill gets looked at. I'm not going to read over all these because of brevity that you've asked for, Chairman. But I do think the first two bullets I said, I just want to amplify. One is we really think you need to, in this bill, amplify some of what you want to get to, what the outcomes that you're wanting to achieve by this bill, and need to be somewhat clearly articulated. And we suggest that you incorporate some sort of like tangible values into this bill, such as what are you expecting of caseload sizes? What will be the standards for caseload sizes? Things like that will really help guide and direct this conversation.
My agency, Childkind, we provide foster care services, one of our programs, to children with very complex medical conditions called medically fragile. And the typical placement process is the child leaves the hospital, then goes into one of our foster homes. And the thing that concerns me about a contract process that you have to have a way to deal with the outliers, I would call them, the children that don't fit the typical pattern, whether they be children with significant behavioral issues, medically fragile children, both in terms of the placement process, the amount of time they spend in foster care, because it will always be longer. In addition to that, how you approach adoption of such a child. We also have a family preservation program, and we're working with a parent who adopted 4 medically fragile children when she and her husband were much younger. The children, the husband is dead, she's much older and weaker, the children got bigger, and the children now are adults, and they came off of EPSDT waiver services, and she's left hanging now with all of these children and has no supports. And our team has been working with her for months to get things organized.
I'm the executive director and the founder of the Foster Care Support Foundation. It's a nonprofit that receives absolutely no government funds. And we provide for 3,000 of Georgia's foster children every year and displaced children throughout the state. What we do is we provide clothing, toys, safe infant equipment. We also provide some training for foster parents, and we have a partnership that we have been working with DFCS to help faith-based organizations recruit families from their congregations and work directly with the system, which has been very successful. The issues and the concerns that I have about this bill is that it is going very fast and too fast to really look into all of the pros and cons. I don't think that there's enough that has been really uncovered and talked about to be able to make a clear decision, an informed decision, and that concerns me. We work at Foster Care Support with private agencies and county homes. We serve them both equally if they're in basic care homes. We have done this for 13 years. 36,000 children have come through. We get to know the caseworkers from all. We get to know the caseworkers from private agencies, along with also the county agencies throughout the state. We also get to know the foster parents. We have not seen an improved number of quality homes in private versus county. Now, in the past, that wasn't true. In the past, we saw a much improved quality of foster homes in the private sector. We don't see that anymore. We have had a huge improvement. The state has done a fabulous job on the recruitment of better homes, more quality homes. And so my concern is that moving to a privatized system is not going to improve the foster care system that we have. We have quite a good foster care system, as you heard Melissa talk about, and also Tom. And the problem is really up front in the management and the investigation process.